Why healthcare professionals should care about physical activity. Let's take a look at what happens to someone with a chronic disorder when they do incorporate physical activity into their daily life. Research has shown that if this person increases their amount of exercise from 0 hours to 1 hour a week, the risk of heart disease is decreased by 50%. In many cases, even without medication, you can see the health benefits of physical activity. For example, let's say that this person had a cardiac issue. Dr. Rainer Hemberbeck, a German researcher, found that when comparing the cardiac patients who received an angioplasty with stent placement, patients who received a treatment approach including physical activity, that the physical activity approach ended up having better results in the long run. Now, this can be surprising. Why isn't a long research in practice surgery more beneficial than physical activity? The key is that regular physical activity has benefits for the whole body, while the angioplasty with stent is just fixing one part of the body. While most people see physical activity as a chore or as a way of altering their physical appearance, it really can be seen as a form of healthcare. There are countless health benefits from regularly exercising, so taking the time to work out should be looked at as a way to prevent the difficulties and costs of healthcare in the future. Doing more physical activity now leads to better health later in life. Research done by Gregory Rutensager and Frank Booth show that lifelong exercise can delay up to 40 different chronic diseases and conditions. Looking back at the individual with the heart condition, this could have been delayed or possibly even prevented with earlier onset of physical activity. Now, let's take a look at someone who has a chronic disease and does not do any type of physical activity. Physical inactivity increases both morbidity and mortality. The risk of death for this person is going to be increased by 30 to 50%, mainly due to the fact that the physical inactivity causes a shorter health span and an early mortality, as well as the quality of life for chronic diseases is decreased. Now, the biological aging, or the deterioration of functional properties of cells, tissues, and organ levels, is also sped up as a result of physical inactivity. Similarly, the progression of severity of chronic diseases speeds up after periods of continuous physical inactivity. Most importantly, research shows that physical inactivity actually causes risk factors for disease. A study of differing activity levels of bus drivers in London proved that those who partook in exercising had a 30% less chance of heart disease, were older when it developed, and had lower death rates. Indirectly related to health, the cost of healthcare increases due to physical inactivity. All of these reasons are a direct result of physical inactivity in someone diagnosed with a chronic disease, and why healthcare professionals should care about physical activity. Many people are aware of the long-term benefits of exercise, like a decreased risk for heart disease, which is the #1 killer in the US, obesity, stroke, and premature death. But you cannot reap those benefits until much later in your life. Even people on weight loss programs have trouble staying on track unless they are seeing steady results. Seeing results and being rewarded is what drives people to continue doing whatever they are doing to give them a benefit. Many people don't realize that losing weight is not the only thing physical activity is for. There are many other immediate effects on the person as a whole that people will benefit from by doing physical activity, such as improvements in mental health, mood, emotional state, confidence and self-esteem, energy, sleep and focus. There are also decreases in stress, anxiety, and symptoms of depression. In the past 26 years, over 1,000 articles involving the relationship between exercise and psychological health have been published. The enhancement of mental well-being is felt immediately after exercise and could act as a better motivator to live a healthier lifestyle. Physicians should focus on this aspect more in order to improve the well-being of the entire patient and not just their physical health. With the patients feeling the rewards of staying physically active, the long-term effects of physical activity will come easy since they already have a healthy lifestyle. Now, physicians should not only pay attention to these short-term effects of physical activity, but they also should pay attention to the long-term effects. There's a long list of negative long-term effects from being physically inactive that physicians should be aware of. Here are some examples. A study from PsychoRev Journal shows that individuals who are physically inactive have a 45% increase in their chances of developing heart disease, increased risk of type 2 diabetes, increased risk of breast cancer, colon cancer, and other cancers, increased risk of dementia, an increased risk of depression, and can contribute to premature mortality, among other chronic illnesses. When discussing the effects of physical activity, it is important to distinguish between the primary and secondary prevention of diseases. Now, primary prevention is the intervention of physical activity and other healthy habits before the development of a chronic illness or disease. Secondary prevention, on the other hand, is the intervention of physical activity and other healthy habits after the development of chronic illnesses or diseases. It is important for physicians to encourage physical activity to patients starting at the youngest age possible, so all of their patients can have the best life health outcomes possible.